Good afternoon, everyone. Welcome, Dr. Leffler. Thank you for joining us for this March 10th COVID-19 briefing. I'd like to begin today's briefing by recognizing that tomorrow marks the 1-year anniversary of the first case of COVID-19 diagnosed in Chittenden County. It's hard to wrap our minds fully around the extent to which this virus has changed all of our lives over the last year. I encourage everyone to try to pause and reflect on this anniversary in whatever way makes sense for you in the coming days. We've been through so much over the last year, and it's worth remembering those we have lost, recognizing the ways this virus has dramatically changed the lives of every one of us, and preparing ourselves for the day not too far away when our lives will be able to expand again. I find great hope in where we are right now with the supply of vaccine increasing virtually every day, it seems, and more Burlingtonians getting access to this miraculous and life-saving medicine. I want to thank everyone in the Burlington community for the great sacrifice, commitment, and collaboration that has gotten us through the past year and really kept Burlington one of the safest cities in the country throughout this incredible period. This pandemic isn't over, but we have come a long way, and the end is in sight. Now, I'd like to welcome Dr. Leffler back on the briefing to review the latest local numbers. First, let's take a look at the case counts in Chittenden County. Like the state, I think Olivia's pulling this up here. Like the state, we're seeing a modest uptick in new cases over the last few days. Our 7-day average is now at 36.7 new cases per day, down from about 28 cases per day last week. There is some good news within this number, and that is that after a sharp increase in cases at UVM about 3 weeks ago, case growth at UVM has now returned to a stable level. For both the week of 3/1 to 3/7 and the prior week of February 22nd to the 28th, UVM reported 31 students who tested positive each week. And so there's been a stabilization there, and that's lower than the prior weeks. Over that same 2-week period, UVM performed a remarkable, truly 31,539 tests for COVID-19 among the UVM community, students, faculty, and staff. And that, I think, is the most visible example of a number of steps UVM took to respond to increasing cases and act to get new positives under control, as they had committed to doing as part of their reopening plans. So I do appreciate that, and I think it should be noted. Dr. Leffler, what do you make of the latest case numbers? Any observations you have about what's happened at UVM and what's going on at the medical center?
I'll start with saying that, what's happened at UVM, it's happened a couple other times in Vermont. We had a Winooski outbreak early on, if people remember. We've had a couple other school outbreaks, nursing home outbreaks, but every time we've used science, and we've used the ability to track people, quarantine them, ask them to cooperate, and got them back under control. And so the UVM data reflects exactly what's happened over and over again. And it's one of the reasons that Vermont has been able to avoid the high number of deaths that's happened in so many other states. At the medical center, we have 10 patients with COVID today. So that's slightly more than it was a couple of days ago, but we've been running between 7 and 10 for the past week. We have 2 people in the ICU, plenty of ICU and ventilator capacity. If you look at as recently as late January, we very often had 15 to 25 people in the hospital with COVID. Now we're down to 7 to 10 with a slight uptick over the past couple of days, but still markedly better. And every day that more Vermonters get vaccinated decreases the risk of them ending up in the hospital or our ICUs. So the progress around vaccination is so encouraging and so important.
Let's talk a little more about vaccinations, Dr. Leffler. So as of March 6th, more than 32,000 people in Chittenden County have now received their first dose of the vaccine. About 88% of people 75 and over have now been vaccinated in Chittenden County, which is, from my perspective, a very positive result. 74% of those 70 and over have now been vaccinated, and about 44% of those 65 and over. Even better news is that more people are now eligible to make an appointment to receive a vaccine. You can make an appointment to receive the vaccine if you are, here are the categories: 65 and older, 55 and older, and have certain high risk health conditions, work in public safety or work in schools or childcare centers. Note that those in the education community will receive information about how to register from your schools directly. And next up, starting tomorrow, March 11th at 8:15 a.m., those 16 and older with high risk conditions can make an appointment to be vaccinated. For a detailed list of these conditions and to make an appointment, go to healthvermont.gov/myvaccine. And yesterday, the state also expanded eligibility to include the entire household of people in Vermont who are eligible and also from a member of a BIPOC community. They're Black, Indigenous, or a person of color. I'm going to speak a little bit more on my thoughts on that important step a little bit later in the briefing. But before that, Dr. Leffler, what are your reflections on this latest vaccine news?
So the news that I think is most encouraging is even the most conservative epidemiologists say that, you need to get to 70%. If you get to 70%, we'd have good herd immunity. So when you hear that 88% of people over 75 plus have been vaccinated, we're closing in on 70% for people above the age of 70, Vermonters are choosing to be vaccinated. Vermonters are choosing to keep themselves safe, their families safe, and their neighbors safe. So that news is incredibly good news for all of us. And as you've said, we keep getting, gradually increased amounts of vaccine. And I think it's going to open up more broadly in the near future to get everyone who wants a vaccine a dose. That's not that far away. It's in sight.
So in fact, President Biden has indicated now that by May, just about 2 months from now, there should be enough vaccine for every adult to be inoculated. I've been a little unsure. I don't know if you can add some light, Dr. Leffler. What is that commitment going to translate to on the ground? Once the vaccine is available, could there still be some lag before that every adult has the opportunity to get vaccinated, or is that a projection on when we should all be able to, really be protected?
So I think it's different for different states because there's two parts to it, right? And we've gotten much better at this. The most important part is having enough vaccine, but then you have to have places that are able to safely administer vaccine, store it, take care of it. The good news is that the first two vaccines that we got were complicated to store, complicated to mix up, complicated to dose, but Johnson & Johnson is markedly easier. It's likely that AstraZeneca is going to be an easier vaccine to administer, which means there'll be more opportunities for people to get it in other locations. You may be able to get it in your primary care doctor's office, other pharmacies. I could imagine school clinics where people could go in their communities and get it, especially for Johnson & Johnson. So I think in Vermont, I would be very, very surprised if as soon as we have enough vaccine to vaccinate every Vermonter, we don't have the pieces in place to get it done, to very quickly roll it out and get, within weeks to a month, everyone who wants a dose will have one. The trick is getting enough doses here. But the state has been regularly talking to providers about that, has a good distribution system already in place. So I would think in Vermont, if you assume we get enough doses for every Vermonter by, let's say, mid to late May, 15th of June, we should be in great shape. Something like that. 15th of June, everyone would have their dose and have 14 days out to get full immunity.
Sorry, Dr. Leffler.
Dr. Leffler, I think the mayor is troubleshooting some tech issues.
Okay.
Oh, Mayor, you might be back.
I am back. Can you hear me okay?
Yeah.
Yes, that's better.
Sorry, Dr. Leffler.
Sorry.
Olivia, can you hear me now?
Yes,
Yes.
I can.
All right. Apologies for that. Good. I think we're going to let you go here in a second. Dr. Leffler, any final thoughts as we hit this 1 year anniversary?
Yeah, I mean, we've talked a lot about this in the past year over and over again. It's truly an amazing accomplishment of modern science to be able to have everyone vaccinated within just a couple of months over a year for a brand new novel pandemic. I do want to comment, though, that we are still occasionally seeing people who show up in our emergency departments or our offices who are avoiding really important healthcare because of fear of the virus. I want people to know that if you're having serious or concerning symptoms or a problem that you're worried about, please seek medical care. Get in and see your provider. Make sure you get taken care of. There are people who are having avoidable complications from not getting medical care. So if you need to have something checked out, please feel confident and safe that we can care for you in a safe way and help you will not catch COVID with your medical providers. They're vaccinated now. They're safe. We have amazing good protocols. And sign up to get vaccinated when it's your turn.
Excellent. Actually, Dr. Leffler, before we let you go, there is one important additional thing that's happened since the last time we spoke, which is that the CDC came out with some, I think, really welcome new guidance on what Burlingtonians and Vermonters or Americans can do once they have been vaccinated. Now that we do have those high percentages of our older populations vaccinated, there is new guidance that has come out about what is appropriate. I know this is something that we were looking for. My parents have been vaccinated recently. Can you speak to what this new guidance is and anything you really want to emphasize about it? It does strike to me as a very significant moment that that this new guidance is now out.
So the CDC is basically acknowledging that these vaccines work, that they're effective. They prevent you from getting COVID, and all evidence to this point shows that they are extremely good at preventing you from spreading COVID. That once you've been vaccinated, your risk of giving someone else COVID is remarkably low. And with that knowledge and information from the CDC, they're starting to let vaccinated people gather in small groups, travel some, not have to quarantine after low risk exposures. And so you're starting to see some of the things open up in the world that you'd hope for as you got more people vaccinated. So once again, if you think about enough vaccine in Vermont by the end of May, everyone choosing to get dosed or everyone that is appropriate to get dosed, get to 15 days later when you've gotten good immunity, we will be able to gather. Vaccinated people will be able to come together in groups. Vaccinated people will be able to, if they do come near someone who has COVID, not have to quarantine. I think it'll get us back to having lots of stuff in person that right now we haven't done for a long time. I think it'll be a great news for the fall for our schools and school sports and all those things. And I think over the summer, you'll be able to see us doing more of the things that we like to do. I'm not going to say it's going to be completely normal in the summer. I do think there'll be some situations where people will still be wearing masks. I think there still will be some situations where maybe we don't fill some venues like we have we always did in the past. But I also think that's coming too. We're just going to have to be careful and smart. And so I think the CDC is taking a careful, proactive approach, letting a little bit more happen, kind of seeing what happens, and then going from there. I like their approach, and we're trying to do it similarly in the hospital. I'm talking about, when can we loosen up our visitor policy a little bit? When can we start to have some in-person meetings for our learners? Those kind of things, we're having the same conversations right now, and then keeping a very close eye on what happens when you do that.
Excellent. Good. Well, great. Always great having you here. It's amazing how every week or so this pandemic takes a new shift and a new turn, and there's new information to talk through. I really appreciate your commitment to helping the community understand, work its way through this, and we'll have you back again soon. And looking forward to this.
All right.
Looking forward to having you back again soon and continuing to make progress here. Take care, Dr.
Thanks, everyone. Thank you, Mayor.
So I'd like to return now and say just a little bit more about the expanded eligibility to receive the vaccine. This is something that we really, since vaccinations began, the city has been very focused on equity issues and ensuring that we, as we have tried throughout the rest of the pandemic, ensure that our public health response is a just response. The state announced an important step yesterday that the entire household of people in Vermont who are eligible and are also Black, Indigenous, or a person of color can now receive the vaccine, even for members of the household who aren't otherwise eligible. And we applaud that. It's an important step, and I think will have some really pragmatic, positive impacts immediately from that decision. This is a city, I want to be clear that this is a position the city, among the things that the city has been advocating for weeks now, to increase access to the vaccine for BIPOC residents who we know nationally and with it, the state's own data, we know there are severe health disparities related to race that we have to take proactive steps to address. And this is definitely an important step in that direction. I do want to be clear that from my perspective, as we this continues to unfold, the city of Burlington thinks that we could do even more at this stage to ensure that these disparities are closed and that the most vulnerable members of our community have access to the vaccine. My belief is that vaccine eligibility should now be open to all people in Vermont who are Black, Indigenous, or a person of color at this stage, regardless of their age or whether they have other underlying health conditions. It has been shown in this pandemic that just being a member of those groups is a risk factor, and that, from my perspective, should be addressed now. I've shared this position with the state, and the city is prepared to back this up and support this effort however we can, through outreach and through the setting up. And something else that we think that should be done is that there should be, since we know that there is, for a variety of reasons, some additional hesitancy to get vaccinated among BIPOC communities, we think special clinics should be expanded for more BIPOC communities, as another way of addressing that hesitancy and expanding access and vaccination within at-risk communities. And that too is something the city is prepared to help with the logistics to make happen. On another matter, related to vaccine eligibility, I want to say here, I'm continuing to advocate now that there has been a significant expansion of essential workers to get prioritization and vaccination. I am continuing to advocate for essential frontline city workers to be eligible to receive the vaccine. We depend on a number of essential workers to keep critical city operations going. For example, our water plant operators and snowplow drivers. And many of these individuals are basically impossible to replace if they do get sick on a short-term and immediate basis, and they are critical to city operations. And we have made that position clear to the Department of Health and continue to advocate there. All right, I'd like to shift topics now to the city's wastewater monitoring program. I'd like to share a brief update on the latest results from the city's wastewater monitoring program. I'm joined now by Brian Lowe, our Chief Innovation Officer and COVID-19 response leader. Brian, what can you share about the most recent results from our wastewater testing? And maybe you could speak a little to just the confirmation that has now come from the state about what we had found about a month ago about the arrival of the variants.
Hey, thanks very much, Mayor. I'll speak to both those things in turn. And Olivia, thanks for this slide. As you can see here, this is a graph that we've shown before on a log scale showing with these 3 different color lines, the trajectory of RNA, viral RNA prevalence at each of the 3 city wastewater plants. I know it's hard to read over Zoom, and so the east plant is the red line, the green line is our main plant, and the blue line is the north plant. And you can see it's kind of a mixed bag of news at this point. We have a trend line that is fairly down in the New North End. Our latest sample was a little bit higher, but generally downward trend in the New North End. And then in the east plant, kind of rising trend, and the same in the main plant, a rising trend of viral RNA. The main plant is a huge plant covering a significant portion of the town, the Old North End, the downtown, the South End, hill section, and some of the campus. So that is a large area, and we break that down into component parts about once a week to see if we can see any other trends underway there. And what I would say here is that while you have a fairly high set of readings in the east side of the city and a rising trend, the Old North End of the city is the area that has a little bit of a rising trend currently in terms of the prevalence of viral RNA. The south end of the city is also kind of on a similar trajectory to the New North End, generally down. And so the main plant trend line is up, and that risk is concentrated primarily in the downtown and Old North End of the city. In terms of your question there, Mayor, I think it was obviously disheartening to hear that the variant has been officially identified in Vermont, not surprising, but also, in a way, a helpful validation of this surveillance effort here to corroborate these findings.
Great, thank you for that report, Brian. Anything else you'd like to add before we move on?
No, nothing further from me. Thank you.
Okay, why don't you stick around in case there are questions about the wastewater. And thank you again for the leadership you've played along with our water resources team in getting this capacity stood up. It is striking just the additional the speed with which we were able to get that information because of this effort, and it's much appreciated, and I think has helped Burlingtonians be aware of the risks that are out there, and been a factor as for the city to continue to navigate its way well through these hopefully final weeks and months of the pandemic here.
Thank you, Mayor.
Okay, last topic. We want to welcome back onto the briefing Tracy Schamberger and Aaron Rokel from AgeWell. We talked before about the really high uptake of the vaccine from our senior communities, and one of the reasons, a big reason that there has been some such success and so much work is still underway, so those numbers are going to go even higher in the weeks to come, is that there have been many organizations, families, and individuals who have been focused on achieving this, and really a leader amongst that effort has been AgeWell. Since seniors started becoming eligible to receive the vaccine, AgeWell has gone to great lengths to make sure that all older residents in Burlington and the surrounding area had the information they needed to access this vaccine. AgeWell has done this by taking calls to its helpline that we've talked about and helped publicize on past briefings. And through those helplines, they've gotten help to older adults with transportation or mobility challenges, either by getting them transportation or in some cases to actually get vaccinations to take place in the home. And they have proactively called thousands of Vermonters now to make sure that they know they're eligible and to see what questions they have. Tracy and Aaron, I want to really thank you for this rigorous, granular work that you've been doing. My sense is this has really helped push those numbers in these very high risk groups up. And we want to just have you come back and share any additional thoughts that you have, anything that we can do and the community can do right now to continue helping you get the word out and succeed in these efforts.
Thank you very much, Mayor Weinberger. It's so nice to be here. First of all, I want to thank the city of Burlington because you've been incredibly supportive in helping us share information, also translate information. Many of the communities and people that we serve has been part of this discussion English is not their first language. And so sharing that information in mailers and spreading the word is incredibly valuable. And I'm so thrilled to see the number of older Vermonters who have been vaccinated. You have no idea how happy that makes us. As many of you probably know, AgeWell is one of 5 of the agencies on aging throughout the state of Vermont. We serve older Vermonters 60 and above, and those with under 60 with a disability. We're extremely fortunate that we have such strong community partners like the City of Burlington. Since the beginning of COVID, we've worked very collaboratively with our partners to make sure that everyone who's eligible knows that they have support and services and resources available to them at AgeWell. The vaccine has been our primary focus, obviously, lately, but in addition to that, we spend a tremendous amount of work and effort in making sure that older Vermonters are not food insecure through our Meals on Wheels program, and also through our care and service coordination team, who provides resources and wraparound services to make sure that people know what's available to them to be able to support them at home. In addition, we have a huge volunteer team, many of those volunteers in the Burlington community. And I just have to give a little shout out to them because they are spending many, many hours calling people to check in on them, because our biggest concern is always social isolation. Many people are feeling disconnected, and particularly older Vermonters. So my colleague Erin is going to give you an update on what we've been doing to support the community in regard to access to the vaccine. Erin is our Director of Care and Service Coordination and oversees that very large team. So I'm going to turn it over to her.
Thanks, Tracy. So I'll just give a brief update. And I think you captured some of the things that we've been doing to reach out to older adults in our service area. The helpline certainly is a main point of access to all of our services, but beyond that, it's not just the way to get connected to AgeWell services, it's also the way to get information about anything or connected to other services in the community. Just for reference, we receive anywhere between 1,500 and 2,000 calls on average to our helpline every month. And we've seen that fluctuate at various points throughout the pandemic in response to either changing guidelines and requirements and restrictions early on, and now, of course, with each wave of new vaccine rollout. So, we interact with individuals who may be on one of those services that Tracy mentioned, or several of those services, and then also really anybody in the community 60 plus, or anybody who's calling about somebody who's 60 plus through our helpline. So we've done a few different things. Our care and service coordination team, as Tracy mentioned, is quite large. In general, we're working with between 800 and 1,000 older adults through that program who have a dedicated care and service coordinator or case manager. So we've been actually doing direct outreach calls to each of those individuals as they become eligible, to make sure that they know that they're eligible, and also that they understand the process of how to access registration or transportation, or if they do need an in-home vaccine. We've also been contacting clients who are receiving Meals on Wheels or volunteer services, and also some clients who may have contacted our helpline in the past, but not be actively receiving one of our services. I think Tracy mentioned previously that we sent out a recorded phone message that was recorded by one of our staff to over 2,000 older adults just recently, to just give them a quick, direct to their phone update. Hey, we've got, we understand that you're now eligible. Here's the process for registering, contact us if you need more assistance. And I think as Tracy said as well, we've really been focused on helping clients who may have restrictions to leave their home. Either they've got a medical condition that makes it very difficult to leave the home, they're lacking transportation to get to a vaccination clinic, or any number of other barriers. And we're assisting those individuals both through the direct outreach calls that we're making to clients who are actively receiving our services, and then also through the helpline. So we've been working very closely with UVM Home Health and Hospice and Garnet Transport medicine, excuse me, who are actually administering the vaccines in the homes for those who are not able to leave their homes. We're really trying to work with transportation providers as well to get anyone who is able to leave but doesn't have access to reliable transportation to get to a clinic. So I believe as of today, we've connected about 130 older adults in our service area to in-home vaccinations with one of those two partners. And we've certainly helped hundreds of other clients with access to transportation to get to those clinics. So the work is ongoing, but very, very important. And I think the interesting thing is that we're finding that many of the clients who we're talking to, or many of the older adults who we're talking to who feel that they're unable to leave their home to get a vaccine, have not taken any steps up until our call to register a vaccine because they didn't think that they would be able to receive one. So we see that as a really important part of the outreach that we're doing both at AgeWell and in strong collaboration with our community partners. And Tracy, I know things have shifted a little bit. If you want to just talk about what we're doing going forward.
Sure. So as of Monday, we know that the Vermont Department of Health has developed a call center. And I think it's important that people know if you're homebound or if you think you're homebound, you can always call the helpline at AgeWell to find out, how you can get the services. But if you are homebound and you need to reach the Vermont Department of Health to be able to get scheduled to get a vaccine at home, there is a phone number for that, and I can provide it here, but it would be also great to put it on the city site, the resource and recovery site. And that number for the VDH is 833-722-0860. And AgeWell will be moving forward, referring people who are homebound to the VDH so that they can get an in-home vaccination. However, we continue at AgeWell to refer our helpline as a no wrong door. And I love that because basically that means that our team is available to anyone for any reason, whether you're 60 or you're a family member or someone in the community who's concerned about someone or you have a disability. And we want to make sure people are connected to this proper services. So if you're questioning, you're not quite sure, just call the helpline. And I continue to promote the helpline everywhere I can. I know that it's probably on the city site, but that number for the helpline is 1-800-642-5119. This is a statewide helpline. So even if you're listening and you're not in the Addison, Chittenden, Grand Isle, or Franklin County area, it doesn't matter. You can still call the helpline, and wherever the call originates from, we'll connect you to your closest agency on aging. In Burlington area and Chittenden County, that would be AgeWell. But the process has been going along quite smoothly. We have not seen any hiccups or wait lists. We seem to be able to manage everything that's been coming in. So we're not expecting any change. And all I can say is we're here and we're happy to help as always.
Well, Tracy, Aaron, that's a great report. It is really heartwarming to know that you're able to provide that kind of direct support. I think at one earlier stage when we had you on, you were getting some sense that some people weren't signing up because they didn't want to be kind of selfish about it. They didn't want, they wanted others to go first. Has that shifted? What are you hearing in these calls now? Is there any kind of theme to why people still haven't signed up if they haven't, that you've detected, or do you think the word is really getting out and we're getting this done?
I think there's always that theme with vaccinations, and then also with many of the services that are available even outside of the pandemic. We hear that about Meals on Wheels and access to food benefits. Vermonters are fiercely independent, as we know, and also very community minded. And so I think there's always that sense of, I don't want to take something away from somebody else. What's been really helpful, I think, with encouraging older Vermonters to register when they're eligible is just reminding them that that is actually what they can do for their community at this time, is registering as soon as they're eligible, and making sure that they're moving forward with that process. And I think that people have been very receptive to that.
Great, great. Are you able also, since I know one of the other issues that you really help people battle and have throughout this pandemic is isolation, are you able to help get some of that guidance that we were talking about with Dr. Leffler earlier? I sense that probably everyone that could benefit from that doesn't realize yet the kind of CDC recommended, what is now okay, and is that, do you get that? Do you help get that information out to the people you're working with? Is that something you can do?
We do, yeah. So we've been staying very closely connected to older Vermonters throughout the whole course of the pandemic. And while a lot of our conversations have been around vaccine eligibility, we're pretty constantly keeping folks up to date about any changes in requirements, whether that's increasing or lessening restrictions based on where they may be. So our care and service team makes at least monthly calls, and for many older Vermonters who are connected to a case manager or care and service coordinator, it's even more often than that. And so at that point, they may be getting updates from their contact at AgeWell about those changing restrictions. And we certainly get a lot of calls on the helpline, just wanting to speak to somebody who has an update, and we're providing that information there as well. Great.
Well, awesome. Really great update. It's impressive the number of calls that you get. 1,500 to 2,000 calls a month is a lot. This is a great update. Thank you. Why don't you guys stick around? Maybe we have a few members of the media that are with us, and we'll go see if there are any questions that maybe for you guys. So Olivia, do we have any questions?
Yes, we do. And a reminder for members of the media, you can get in the question queue just by sending me an email. So the first question is from Carolyn at NBC5. And one second. Carolyn, you should be able to enable your microphone.
Can you hear me?
Yes.
Perfect. Hi, thanks for taking my question. You answered a little bit about it when you were talking about the BIPOC community and being able to now get a vaccine if you're in an eligible household. But specifically in Burlington, at either educationally or at clinics, what are you doing to kind of try to limit some of the barriers that community might be seeing when trying to get a vaccine?
Thanks, Carolyn. We've been very concerned about this from the start of the vaccination efforts in December and January. One of the important things that we advocated for that has been in place basically from the start of the community vaccinations is having walkable sites in Burlington and Winooski that people can sign up for to try to lessen that transportation barrier from communities that are in walkable communities and households that might not have a car. We have been working very hard with a number, just as you've been hearing from AgeWell about how the city's been working with the AgeWell and other senior providers to get information out to all of our seniors and individuals living in nursing homes. We've had a kind of a parallel effort, very much focused on strong communication with our immigrant communities and our BIPOC communities. We have set up during the pandemic a program called the Trusted Community Voices Program, as well as a separate team called the Rapid Response Team. And we use those two teams to get information out and get feedback and information back from our BIPOC communities. And it is from that information that is one of the reasons we have been advocating for these special clinics to serve both immigrant limited English proficiency communities, as well as sort of broader BIPOC communities that, because of historic injustice and a variety of other factors, have some additional hesitancy when it's coming to vaccination. We know that certainly from the national data that vaccinations in BIPOC communities is lagging behind that of white communities. And so we've been trying to combat that through good communication and through advocacy for these additional clinics, which have been started to a certain degree, and which we think there should be more of going forward. Do you want to add anything to that, Brian?
Sure. Thank you, Mayor. In addition to what the mayor said, there's also a group led by the Winooski Town Manager, Jesse Baker, that meets 3 times a week with different organizations, primarily focused on those with limited English proficiency in the community. And so sometimes that overlaps with Black, Indigenous, and people of color. Sometimes it does not. There is also an internal city communications team focused on Black, Indigenous, and persons of color communication out to different groups in and around Burlington to make sure that information is shared through non-traditional channels as well, and that people have access to information to make their own and informed decision. That group has done some work as well to help identify additional potential sites for additional clinics, as the mayor mentioned, that have been passed on to the Department of Health. And as the mayor noted, the city is ready to support those clinics through registration, outreach, and that kind of back-end administrative staffing support if needed.
Oh, and just a quick follow-up to that, if I can. Right now, as it is, if somebody does have that language barrier and needs a translator or something like that, how is the city able to provide that kind of service?
Oh, go ahead, Mayor, sorry.
Well, the Burlington Winooski sites, community sites have from the start routinely, whenever those sites are open, they have translators there. That's in addition to these special limited English proficiency clinics. So there's been a real focus in those settings on having translators. Are there translators at other sites as well, Brian?
Yes, there are translators or interpreters at every test site in Burlington and in Winooski. But beyond that, there's a multilingual task force where a number of organizations have done just really incredible work. That's USCRI Vermont, AALV, LEND, and a number of other organizations have supported the Department of Health, provide translations, provide interpretation, help share information about these test sites, vaccine clinics, eligibility through a variety of channels in different languages. The city also has relatively recently started a newsletter that's translated into 7 different languages each month that tries to highlight kind of the most salient information and make sure that's shared through all our channels as well.
Thank you so much.
Thank you, Carolyn.
Great. The next question is from Katya at VT Digger. Katya, you should be able to enable your microphone.
Hey there, can you guys hear me?
Yes, we can, Katya. Go ahead.
Wonderful. So I would just love a little bit more clarity on what you mean by these specialized clinics. I know you said some for limited English proficiency in particular, or are they for, or I just like, what is your vision for these clinics? And then like, do some of them exist, or if not, like, how are you sort of advocating for them on a state level?
Yeah.
That all makes sense.
So there have been for some weeks now additional clinics for limited English proficiency clinics. And Brian, why don't you speak to add any detail that we can share there about those?
Sure. The state and a number of the partners that I referenced before have really worked to provide these additional clinics because the registration process is cumbersome and confusing, particularly if English isn't your first language. And there's been real concern about the disparity opening up nationally and also in state data about kind of vaccination rates for Black, Indigenous, and people of color in Vermont. And so the limited English proficiency clinics run at least twice a week, one in Burlington, one in Winooski, and have now for, I think 6 or 7 weeks. I'm not certain of that exact time frame, but I believe it would be early February, the very end of January is when they started. What the mayor is saying is, in addition to those, the city is ready to support and has been advocating for additional clinics for BIPOC Vermonters who may not be in refugee or immigrant populations, Black, Indigenous, and people of color in Vermont who meet the current eligibility criteria will be able to bring their household along with them as an additional clinic beyond what the state spoke to yesterday. And I think, Mayor, I don't want to speak for you, but I think it's even further than that in terms of removing eligibility criteria restrictions.
That's right. The feedback we've gotten from BIPOC communities is that it would be helpful to spreading the word and breaking down some of the hesitancy that BIPOC communities have had about vaccinations, for there to be these specialized clinics in locations that these communities frequent and trust, and that would involve leaders from these communities. That's our vision of how we could help reach some of these harder to reach populations. And then beyond that, yes, I do think, given the extreme racial disparities that we have seen from the very beginning of this pandemic, my perspective is we should just open up vaccinations at this point, now that we have reached the point that we can offer it to anyone with basically a health risk factor. I think race has proven to be a risk factor in this pandemic, and we should just open it up to adults, people over 16, that are from these at-risk communities, and put them at the front of the line with other individuals who have health risk factors at this point. And it's something we've been advocating for some time, and it's a further step that I continue to think at this point we should take.
Okay, thank you. That's all I have. Appreciate the
Great,
answers.
thank you, Katya.
All right, and it looks like that is all the questions we have for today.
Great, thank you everyone for tuning in. Tracy and Aaron, it's really great to have you here. I really feel Chittenden County is so fortunate to have Age Well operating here, and just really thankful for the ways you've stepped up and innovated during this pandemic. And it's great to just to know that those services have been able to provide that kind of specialized help to hundreds of Chittenden County residents already, and that you're standing by. And I love your no wrong door policy there, Tracy. And I hope we can continue to help get the word out that anyone who has questions about how to serve the seniors during this pandemic, know that they should go ahead and recall that Age Well hotline. So thank you for your service. Thanks for being here with us today. Brian, thank you for being on again. We will be back in touch again soon. Stay safe, everyone.
Thank you for having us. We appreciate it.
Take care.
Take care. Bye-bye.